Like most vaccines, this one is no different. It will have some uh, adverse effects like pain at the injection site, flu-like illness like tiredness, fatigue, muscle aches, joint and pain, even nausea, vomiting, like that. They can come up depending on the individual. Okay, so allergic reaction. There are certain group of people that are allergic to so many things. Um, but in the Moderna trials, they did what is called a double-blinded study, where roughly 30,000 people were given put on trial. So what they did is they divided the two groups. 15,000 are given the actual vaccine, and 15,000 were given what they call placebo, and they compared the side effects amongst the two, and that's how they come up with the numbers. And so what we can say from now, because they're still looking at the data right now, is that most people who took the actual Moderna vaccine developed some side effect, but mostly at the local site.
Okay.
So the most severe side effect you would get from vaccines is what they call anaphylactic shock. So people do get anaphylaxis, but you have to have like epinephrine penetrates on standby to make sure you can prevent that from happening. So you do, so far, Pohnpei State issued over 2,000 doses, none of them have anaphylactic shock. For now, we don't, only 18 and above, and we don't administer to pregnant mother and breastfeeding mothers for now because we don't have enough data to support that. I think just like any other, make sure you're not sick. If you already get a vaccine 2 weeks before you come and get, maybe we should delay it after 2 weeks. If you have fever, we probably won't give you anything. You're currently on some form of medications, we probably would stop you from getting it until you're clear.
Okay.
So you will be receiving 2 doses for the Moderna vaccine at 28 days apart. And you are expected to develop full immunity after 4 to 4 days from the first vaccine, first dose. Well, yes, theoretically they can get vaccinated, and actually it will help because what it does, it will boost their immunity. Those that already have developed some immunity against it, if you give the vaccine, they will boost their immunity against the virus. No, actually, if you are immunized, the likelihood of you spreading as compared to someone who has the virus is very minimal. It's less than 0.001%. Since they started the project on the Moderna vaccine, the trials, they're still keeping track of the first people who were given the vaccine. So far, we know it will protect you roughly about a year. But data is still coming because those that took it in somewhere in the summer last year, 2020, they're still monitoring the immune their immune markers until now. So even if they go beyond 1 year, they will probably get sick. But so far, it's been promising. hopefully somewhere down the line, they will develop a vaccine that you probably receive just once a year, and it will help you protect you for at least a year. Or they may have combined those two, flu and COVID, together. We don't know yet, but those are some of the things that might come down the pike.
Okay.
Yes, okay. The variations that are taking place are within the nucleus, the DNA of the virus, but it doesn't affect the vaccine. Doesn't alter the DNA. It only affects the spike protein of the virus, which is what the aim of the vaccine is to attack that, which is not the. It will take probably decades for this virus to actually mutate and change the spike protein. So it will still be effective against the strains that we have circulating in the globe right now.
I see.
So the Moderna vaccine only prevents you from getting COVID-19. It doesn't prevent you from getting a stroke or something like that. It doesn't affect your DNA like most myths. These are some of the myth busters that we need to make sure people are aware. It doesn't alter any DNA. This is an mRNA vaccine, the latest technology in immunology. If you are diabetic, diabetic and people with underlying diseases are the most ones that need it. It will not alter your diabetes, but it will, when you get the COVID, you will be the one that will suffer probably the most. So if you can protect that, that would be something that's very useful. Vaccine is 95% effective. It's not the bulletproof. You still need to follow the physical distancing, social distancing guidelines. So they have to work together in order for it to be really effective.